Hello everyone, welcome back to Sedu Setsavi Pharma tutorials. So as you all know, we have successfully completed our classes for the Kerala PSC Pharmacist Grade 2 exam, and we are so happy and proud to say that more than 75 questions which has come for this exam has been absolutely discussed from our classroom discussions and our classes. And congratulations to all those who have utilized this facility. Now we are mainly focusing on to this analyst grade 3 exam by the Kerala PSC, which is going to happen in next 4 to 5 months. So as a part of that, we are resuming our MCQ discussions for this analyst exam. And in today's discussion, we'll discuss question number 511 to 520. So without any further delay, let's move on to the first question of the day. So this question is taken from the industrial pharmacy subject which is given in the syllabus. So the question is the Drug Regulatory Authority of UK. A choice EMEA, B choice CDSCO, C choice MHRA, D choice MHLW, and E choice US FDA. So the answer for this question, normally all this EMEA, CDSCO, all they are drug regulatory authority of each country. Now we need to know which all belongs to which all regulatory authority belongs to each country. So CDSCO, you know that is the regulatory authority of India. EMA, it is the regulatory authority of European Union, which consists of 27 countries. MHRA is the regulatory authority of United Kingdom, UK. MHLW is the regulatory authority of Japan. And you all know USFDA, of course, US. Okay, the regulatory authority of US. Okay, so the answer for this question, the right answer for this question is the regulatory authority of UK. Answer is C choice, MHRA. Okay, now you just better you remember this table where I have given all the regulatory authorities of the most important countries which you need to remember for the exam. Now, as already I told you, in India, the regulatory authority is CDSCO. The full name is Central Drug Standard Control Organization, CDSCO. Now, US, you all know USFDA. The full name is United States Food and Drug Administration. When it comes to European Union, as we already told, it is EMEA. What is EMEA? European Medicine Evaluation Agency, which is the regulatory authority of European Union, which consists of 27 countries. Now, MHRA, that is Medicines and Healthcare Products Regulatory Authority, is the regulatory authority of United Kingdom. Whereas MHLW, which stands for Ministry of Health, Labor and Welfare, is the regulatory authority of Japan. When it comes to Australia, it is TGA. Now, what is TGA? Therapeutic Goods Administration. That is the regulatory authority of Australia. Now, it comes to China, it is SFDA. What is SFDA? State Food and Drug Administration. So, better you remember this table, which contains the regulatory authority of all the important countries. Okay. Now, let's move on to the next question, which is taken from the pharmacology. Which of the following receptor stimulation is used for decreasing triglycerides? Not the point. Decreasing triglycerides. A choice, PPAR alpha. B choice, PPAR beta. C choice, PPAR gamma. D choice, both B and C. So the first thing you need to know, what is PPAR? So PPAR stands for, PPAR basically they are transcription factors. They belong to the nuclear receptor family. And the full name is peroxisome proliferator activated receptor. Peroxisome proliferated activated receptor. They are basically transcription factors belonging to the nuclear receptor family. Now this PPAR, basically they are of different types. One is PPAR alpha. They have subtypes, PPAR alpha. Then you have this PPAR beta. Then you have PPAR gamma. You also have PPAR delta. Okay. So PPR beta and delta, they are basically same. Okay, so we'll not discuss that. The most important one is PPR alpha and PPR gamma. Okay, so let's take PPR alpha. Now, PPR alpha, which is a subtype of PPR receptor. So whenever the activation of this PPR happens, it has the ability to increase the triglyceride levels. So PPAR alpha stimulation of this PPAR alpha has the ability to decrease triglyceride levels. Therefore, the drugs which can stimulate this PPAR alpha can be used in the treatment of dyslipidemia. Dyslipidemia. So when you can give a drug which can stimulate this PPAR alpha, it will decrease the triglyceride so that it can be used in the treatment of dyslipidemia. And such drugs, the examples of such drugs which can decrease the triglyceride levels are fibrate drugs. So fibrates are drugs which are used for decreasing the triglyceride level, and this class of drug has the ability to decrease the triglyceride to the maximum amount. Okay? And the examples are fenofibrate. The name ends with the fibrate. Fenofibrate, clofibrate, then ciprofibrate. Also, you need to remember gemfibrocil. The name contains fibrocil. Okay. So these are drugs belonging to the class fibrates, and they are basically PPAR alpha agonist. They are PPAR alpha agonist, and the function is to decrease the triglycerides level. That's why it is used in the treatment of dyslipidemia. Now, the next important class of PPAR subtype is PPAR gamma. So PPAR gamma, nothing but peroxisome proliferated activated receptor gamma subtype. Now, activation of this particular receptor has shown to decrease insulin resistance. So if it decrease insulin resistance, what is the clinical benefit? Yes, we can use in the treatment of diabetes. So those drugs which can stimulate PPAR gamma can be used in the treatment of diabetes mellitus. So is there any drug which can stimulate PPAR gamma and decrease insulin resistance? Yes, you have studied thiazolidine group of drug. So thiazolidine, they are class of drugs which act by stimulating PPAR gamma, and it can decrease insulin resistance. Therefore, they are used in the treatment of diabetes. So thiazolidine, you know that the name of the drug end with glitazone. The name of the drug end with glitazone. And which are the examples? Pioglitazone, pioglitazone, proglitazone, rosiglitazone. So these are some of the examples of anti-diabetic drugs which can stimulate PPAR gamma and decrease the insulin resistance. Okay, now coming back to our question, which of the following receptor stimulation is used for decreasing triglycerides level? So we have already told PPAR alpha. PPAR alpha drugs are basically fibrate drugs. Fibrate drugs. And remember, drugs have the ability to decrease the triglyceride level to the maximum. Okay, remember the triglyceride level is decreased to maximum by fibrate kind of drugs. Where PPAR gamma, the examples are thiazolidine, glitazone drugs. Glitazone drugs. Okay, let's move on to the next question of the day. Which among the following sentence is correct? So again, coming a question from the pharmacology. A choice, potency is more important than efficacy. So here two terms are there. One is potency and efficacy. Okay. So well, potency is more important than efficacy. The second choice, efficacy is more important than potency. The third choice, both the potency and efficacy are same. The fourth choice, efficacy and another term is coming, effectiveness. They are same. Okay. So remember, you need to remember two terms. One is potency. The second term is efficacy. Now, what is the difference? Potency indicates the power of a drug, right? It indicates the power of a drug. That means the dose of a drug. It indicates the dose. So, if a drug, whatever drug which can be used at a minimum dose, they are more potent. So, lower the dose, the drug is more potent. Okay, so potency basically depends on the dose. It is the power of that drug. Okay, and higher the dose, of course, it is vice versa. It will be less potent. But what is efficacy? So efficacy is the maximum effect produced by a drug. So the maximum effect produced by a drug is indicated by a term called as efficacy. The dose is related to potency. Now, among potency and efficacy, which is more important? The answer is efficacy. The maximum effect produced by a drug is more important than potency. Okay, so the correct answer for this question, efficacy is more important than potency. Efficacy is more important than potency. So the correct answer is B choice. Now, the choice A is wrong. Choice, they are not same, they are different. Coming to D choice, there is a new term called as effectiveness. Now remember, this efficacy term is mainly taken from this clinical trials. Okay, so we know that the drug will be tested in various phases of clinical trial, and from that, that word efficacy will come. But actually, in the real situation, the term is effectiveness. So in real situation, the correct terminology is effectiveness. So basically, efficacy and effectiveness, they are not same. They are not same. They are different. That in clinical trial, the word efficacy would be more correct, and in real situation, the effectiveness of a drug would be more appropriate. Okay, although they are related terms, but they are used in different context. Clinical trial in efficacy, and in real situation, in actual situation, the correct term would be effectiveness. Okay, so the sentence correct here is efficacy is more important than potency. Okay, let's move on to the next question. Okay, now the question is, a farmer had an altered, so you need to remember the keywords. This is a question from the pharmacy practice. An altered state of consciousness, profuse sweating, lacrimation, diarrhea, urinary incontinence. So what does it tell? That sweating is more, lacrimation, diarrhea. So that means all the secretions are increased. All the secretions are increased. The GIT movement is more. That indicates diarrhea. Urine outflow is more, incontinence. Urinary output is more, outflow is more. Now, on examination, pupil was constricted. That means meiosis is shown. Meiosis, pupil is constricted. And BP was 80 by 60. Is it normal? No, BP is less, right? So BP is low. Now, what is the drug of choice to treat this condition? Now, first you need to identify what condition is that. You can see that the BP is less. There is a constriction of pupil, that is meiosis. All the secretions are less. The movement of GIT has been increased, that's why it is diarrhea. The urinary bladder has been started contracting, urinary outflow is more. So what kind of problem it is? Which receptor is involved in this thing? So whenever you hear the term meiosis, can you connect it to the muscarinic receptors? Yes. So normally meiosis, you know that in muscarinic receptors, there are M1, M2, and M3 receptors, right? M1, M2, and M3. Now, M1, M2, M3. Now, you know that M2 receptors are mainly present in the heart. So, when you stimulate M2 receptors, what will be the effect on BP? Yes, the BP will come down. M1 receptors are present in the stomach. It will increase the HCl secretion. Now, what about M3? What about M3 receptor? It is present in the GIT. GIT, what it will do? It will increase the tone of the GIT. So what can happen? It can cause diarrhea. M3 receptors are also present in the eye. In eye, what does it do? It constricts the pupil. That is called as meiosis. M3 is also present in all the secretory glands. All the secretory glands. What does it do? It will increase the secretion. That means it will increase the ear glands, it will stimulate, lacrimation would be there, sweating would be there. So all the kind of secretions would be indicated. Now M3 is also present in the urinary bladder. What does it do? It increase the urine outflow. Urine outflow will be increased. So here all the symptoms what is mentioned here, basically it's a stimulation of all the cholinergic system. Okay, cholinergic system is completely stimulated, and you can see that the BP has come down, and this is an indication of a poisoning. And the term here used is a farmer, so definitely they might be encountered with a insecticide. So can you tell me the diagnosis? Yes, this is called as organophosphorus poisoning. So you know that belongs to organophosphorus compound belongs to cholinergic category, right? So this is an indication of organophosphorus poisoning. In organophosphorus poisoning, BP will come down. There will be constriction of pupil, urine outflow, GIT movement, diarrhea, everything would be more. So in organophosphorus poisoning, the drug of choice is what? Yes, the drug of choice is atropine. So atropine is the drug of choice for organophosphorus poisoning, OP poisoning. Okay. So that is the answer for this question, because organophosphorus is a cholinergic drug and you need to give, in the case of poisoning, you need to give an anti-cholinergic drug, and the answer is atropine. Whereas physostigmine, neostigmine, they are basically cholinergic drug. They are nothing to do with this kind of situation. Normally, physostigmine is used as a drug of choice in atropine poison. But here the condition is not atropine poisoning, it is organophosphorus poisoning. Neostigmine is mainly used in the treatment of myasthenia gravis, right? It has nothing to do with adrenal. Adrenal is mainly given for the anaphylactic shock, also in the cardiac arrest. So here the case is organophosphorus poisoning. So the correct answer for this question is atropine. Answer is C choice. So hope you understood this pharmacy question from the pharmacy practice. Now let's move on to the next question. So this question is from the medicinal chemistry. Valproic acid. Valproic acid is produced by the hydrolysis of which compound? A. Pentanoic. B. Hexanoic acid. C. Propyl acetonitrile. D. Dipropyl acetonitrile. So first you need to know what is valproic acid. You know that valproic acid is an anti-epileptic drug. And what is it chemically? Basically, it is 2-propyl pentanoic acid. What is pentanoic acid? It's a 5-carbon acid. And at the second carbon, this is the second carbon, there is a propyl group, right? Propyl means 3-carbon group. So basically the structure of valproic acid is CH3, CH2, CH2, CHCOH, and at this carbon, this is the first carbon, this is the second carbon, a propyl group is attached. So this is that propyl group. Okay, so this is called as valproic acid. So you need to remember the valproic acid, the nomenclature, it is 2-propyl pentanoic acid. 2-propyl pentanoic acid. It belongs to the which class? Aliphatic carboxylic acid. Now the question is that this valproic acid is produced by the hydrolysis of which compound? Which compound? So let's look at into the choice. First choice. The choice in the A choice is pentanoic acid. What is pentanoic acid? It's a 5-carbon acid, right? So this is the structure of pentanoic acid, CH3, CH2, 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 COH. So if you hydrolyze this pentanoic acid, will you get valproic acid? No, because valproic acid has a propyl group also at the second carbon. So this will not give valproic acid. This will not give valproic acid. On simple hydrolysis, pentanoic cannot give valproic acid. Now look at the second choice, hexanoic acid. What is hexanoic acid? 6-carbon acid. So let us draw hexanoic acid. So this is hexanoic acid. So will this hexanoic acid on hydrolysis can produce valproic acid? No, because valproic acid has a propyl group and a 5-carbon. So this also will not give valproic acid. So the both A and B are wrong. Now let's look into the C choice, propyl acetonitrile. So acetonitrile is nothing but this is acetonitrile. Acetonitrile is also called as methyl cyanide. CH3CN is called as acetonitrile. Now the choice was propyl acetonitrile. So propyl acetonitrile means out of this 3 hydrogen, you replace 1 hydrogen and put the propyl group. Propyl means 3-carbon group. Okay. So CH3, CH2, CH2, CH2CN. So this is propyl acetonitrile. Now, do you think that on simple hydrolysis this will give valproic acid? No, the answer is again no, because valproic acid has contained this propyl group also. Okay, additional group also. So this will not give. So again, the answer C would be wrong. So definitely the answer would be D choice, but let's see how that will give. Dipropyl acetonitrile. Dipropyl acetonitrile. So I told you in this is acetonitrile, okay, CH3CN. So I am replacing both the hydrogens and putting dipropyl, 2 propyl groups. So this is 1 propyl and to this carbon second propyl. So this is called as dipropyl acetonitrile. You can balance the valency, CH3, CH2, CH2, CH3, CH2, CH2. Now my question is that on hydrolysis, will this give valproic acid? Yes, because cyanide group on hydrolysis, you look at here, there is a cyanide group. It will be converted to, on hydrolysis, oxygen will be added to here, H2 will be added to here, so it will become CONH2, correct? On hydrolysis, hydrogen will be added to here, OH will be added to here. So what will become? This will become COH, and the byproduct will be ammonia. Okay, so that means this cyano group will be converted to carboxyl group. That means you will get this valproic acid. So the correct answer for this question is dipropyl acetonitrile. Dipropyl acetonitrile. On hydrolysis, subsequent hydrolysis, we can get what? Valproic acid. I hope this discussion is clear. Okay, so answer for this question would be D choice, dipropyl acetonitrile. D choice. Okay, that's fine. Let's move on to the next question. So again, it's a question from the chemistry. Which of the following is a pyrrolo-indole derivative? A choice, ketorolac. B, ketamine. C, indomethacin. D choice, physostigmine. So you know that ketorolac is an NSAID, right? And it is a example for which derivative? Pyrrole derivative. Two pyrrole rings are fused in ketorolac. It is an NSAID. Now, have you heard about ketamine? Ketamine is a dissociative anesthetic. You know that it is a dissociative anesthetic, and the chemistry is it is a phencyclidine derivative. It is a phencyclidine derivative. Now, what about indomethacin? Again, it is an NSAID. And what is the chemistry of that? It is belongs to indole acetic acid derivative. Indole acetic acid derivative. What about physostigmine? It is a cholinergic drug, right? And in fact, it is an example for fusion of pyrrole with the indole. So pyrrolo-indole derivative. So remember, physostigmine is an example for pyrrolo-indole derivative, and it is a cholinergic drug. Whereas don't get confused with the ketorolac, because ketorolac is a pyrrole derivative. Pyrrole derivative. Okay, so remember that uh, classification. Let's move on to, so the correct answer for this question will be Pyrrolo-indole. Yes, the answer is D choice, physostigmine. I hope it is clear for you. Okay. Let's move on to the next question. Again, it's a question from the medicinal chemistry. Isoniazid is chemically. So isoniazid is, you know that it is an anti-TB drug, right? Used in the treatment of TB, first line anti-TB drug. So what is it chemically? A choice, isonicotinic acid hydroside. B choice, isonicotinyl hydrazine. C choice, both A and B. D choice, isonicotinic acid hydrolysine. Which is the correct answer? Let's, so first you need to know what is INH. So isoniazid is abbreviated as INH. It is basically a derivative, it's a pyridine carboxylic acid derivative. So this structure, you know that this ring is called as pyridine, and in this pyridine at the fourth position one carboxyl group is attached. So this pyridine 4 carboxylic acid is called as isonicotinic acid. Isonicotinic acid. Now in this isonicotinic acid you replace this OH. You replace this OH and attach NH2NH2. What is NH2NH2? If you there is, if two NH2 groups are nearby, they are called as hydrazine. Hydrazine. Okay, so you replace that OH with NH2NH2, then this is called as isonicotinic acid hydrazide, or you can simply call it as isonicotinyl. What is NH2NH2? Hydrazine, correct? So either you can call it as isonicotionic acid hydrazide. That is how that abbreviation has come. INH, isonicotinic acid hydrazide, or you can call it as isonicotinyl hydrazine. Again INH. So this is the nomenclature of isoniazid, abbreviated as INH. Now let's look into the choice. Isonicotinic acid hydrazide. Yes, it is correct. It is also called as isonicotinyl hydrazine. So what is the correct answer? Yes, both A and B. Now let's look at this D choice, hydrolysine. Remember, hydrolysine is something different. What we were talking about was NH2 was hydrazine or hydrazide. Okay, hydrolysine is an antihypertensive drug. So that is a different class of compound, nothing to do with hydrazine or NH2. So this is a wrong choice. So the answer for this question is C choice. Let's move on to the next question of the. So again, it is a question taken from the Pharmacology. A 28-year-old schizophrenic male currently under the treatment of haloperidol presented Parkinsonism-like symptom. Drug used in this condition. Now, A choice salicylic, B choice levodopa carbidopa, C choice trihexyphenidyl, D choice pramipexole. Which is the correct answer for this case? So please look at the choice question. A schizophrenic patient, that means a psychotic patient. Okay, so definitely psychotic patients, in psychotic patients, the D2 the dopamine receptors will be elevated. So definitely the drug which is used in this condition will be dopamine antagonist. They will try to block dopamine receptors. So when you drop the dopamine receptors, what will happen? The dopamine level will come down. So that is one of the side effect of antipsychotic drugs. Okay, the dopamine can come down and it can result in Parkinsonism like symptoms. Okay, so this condition is called as drug-induced Parkinsonism. Drug-induced Parkinsonism. And mainly which drug? So antipsychotic drugs can induce Parkinsonism because it will decrease the dopamine level. That is the mechanism of action. So if the dopamine level comes below the normal, that can cause Parkinsonism. And this kind of Parkinsonism is called as drug-induced Parkinsonism. In drug-induced Parkinsonism, remember, in drug-induced Parkinsonism, the drug of choice is benzhexol, benztropine, benzhexol or benzhexol or can benztropine. Another drug is biperidine. Okay, so then so these are the most benzhexol, benztropine, and then one more drug, procyclidine. So these are the drugs which are belongs to a class called as anticholinergic drug. Anticholinergic drug, and these drugs are the drug of choice for drug-induced Parkinsonism. Normal Parkinsonism, it will be the dopamine agonist drug like ropinirole, pramipexole, and all that. Levodopa is a commonly used drug, but in drug-induced Parkinsonism, it will be anticholinergic drug, benzhexol, benztropine, biperidine, or procyclidine. So let's look into the choice whether any of this is there. So A choice, salicylic, levodopa, carbidopa, trihexyphenidyl, pramipexole. There is no such drug. What is the correct answer? Yes, trihexyphenidyl is also called as benzhexol. Benzhexol is also called as trihexyphenidyl. So the correct answer for this question would be C choice. Anticholinergic drug benzhexol, benztropine, biperidine is the drug of choice for drug-induced Parkinsonism. I hope it is clear. Let's move on to the next question. So this question is taken from Microbiology. Microbiology. Which of the following is an example for symbol stain? A choice, methylene blue. B choice, India ink. C choice, silver stain. D choice, gram stain. And E choice, acid fast stain. So which is the correct answer? Now first you need to know staining. Basically, you can divide the stains into 4 categories. So one is the symbol stain. The second one is called as the negative stain. The third one is called as the impregnation stain. And the fourth one is called as the differential stain. So what is the difference between all these stains? So as the word indicates, symbol stain, here only one color would be used. During the staining procedure, only one color would be used. So that means the bacteria will get only one color. For example, if you use methylene blue kind of dye, the bacteria will look like, the color of the bacteria would be blue in color. If you take basic fusion, the color of the bacteria would be red. So that means only one color would be there in the symbol stain. That is the meaning of symbol staining. Okay, methylene blue will give blue color to the bacteria. Basic fusion will give red color to the bacteria. So these are the dyes which are examples for symbol staining. Now in negative stain, here what happens is that the bacteria will be unstained. No staining would be there. No staining. Whereas the background would be stained. The background would be stained. So the bacteria will not get any kind of stain or color. However, the bacteria background would be stained. So that means we can see the bacteria in the background contrast. Okay, so that is called as the negative stain. The bacteria will not get any color. Background would be stained, so we can see the bacteria in the background. Now, the examples for negative stains are India ink and nigrosin. So India ink and nigrosin, they belong to negative stain, where the bacteria will not be stained. Actually, it will stain only the background. Now, if a bacterial structure is very thin, or if a bacterial cell is very thin, then you cannot see under the light microscope. Okay. Therefore, you need to impregnate with some compounds like silver. Okay, so if the bacterial structures are very thin, you cannot see under the normal light microscope. You need to impregnate. You need to make it thick by impregnating it with the silver kind of compounds. So they are called as impregnation stain. So the most common example for silver impregnation stain is silver staining. So normally, you know that the bacteria contain flagella, right? So this flagella kind of structures, they are very, very thin, too thin to be seen under the microscope. So you impregnate it silver, and then it will be examined under the microscope. So for examining this kind of thin structures, you need impregnation stain. One more example is spirochetes. Spirochetes, you know that the treponema group. The treponema group, they are very thin structure. They are very thin. Okay, so you need to impregnate with silver, and then you need to examine under the microscope. Okay, so the silver staining is example for impregnation staining, where the silver will be impregnated, or the bacterial structure will be thickened using this silver. Now, the most commonly used stain is called as the differential stain. Okay, so as the name the word starts with the differ. That means different colors would be used. Here, different colors would be used. Unlike the simple stain where only one color is used, here different colors would be used. So that is the meaning of differential staining, and this is the most commonly used staining. Okay, so the examples are gram staining, acid fast staining, and Albert stain. They belong to differential staining. So let's come back to our question, which of the following is a simple stain? So the answer is methylene blue. That is simple. India ink is example for negative stain. Silver stain is an example for impregnation staining. Gram stain and acid fast staining is an example for differential staining. Okay, so the correct answer for this question would be A choice, methylene blue. Let's move on to the last question of the day. Chlorhexidine is present. It's a question from the inorganic chemistry. Chlorhexidine is present in A choice, Dettol, B choice, Savalone, C choice, both A and B, and D choice, tincture iodine. So what is the answer for this question? It's a simple question. The chlorhexidine is present in Savalone. Okay, B choice, Savalone. Now, some of the important points you need to remember from this thing, which is very important. See, basically, Dettol, you know that it's all these Dettol, Savalone, they are antiseptics. Okay, disinfectant kind of compounds. Their active component in the Dettol is chloroxylenol. So the active component in Dettol is nothing but chloroxylenol. Okay. Now the question is that chloroxylenol will be used at a percentage of 4.8 percentage weight by volume. This point you need to remember. In Dettol, the active component is chloroxylenol, and the percentage is 4.8 percentage weight by volume. Now, also this other components which are inactive components like pine oil, isopropyl alcohol IPA almost at 12 percentage, castor oil soap, caustic soda solution, caramel, and water. So these are the components of Dettol, where chloroxylenol is the active component. Now, when it comes to chlorhexidine, so Savalone, the most important component is chlorohexidine. Okay, so chlorohexidine is used at a percentage 0.3 percentage weight by volume, and also it contains cetrimide. You can see in this bottle itself that chlorhexidine gluconate and cetrimide solution they have written. So they are used at a percentage of 3 percentage weight by volume. So Savalone, the important component is answer is chlorhexidine. Now also you need to remember I told you that in Dettol it is chloroxylenol. Chloroxylenol. Okay, chloroxylenol. So the point you need to remember, chloroxylenol, what is it chemically? So remember, it is chloroxylenol is parachloromethaxylenol. So sometimes in exam it can be asked, what is chloroxylenol chemically? Answer is parachloromethaxylenol. It is abbreviated as PC, parachloromethaxylenol. Okay, if it is asked in the exam, you can remember physics, chemistry, max. You have studied it in the 10th standard, right? X, you can read it like 10th standard. So PCMX, parachloromethaxylenol. It is a component of what? Yes, Dettol, and it is nothing but chloroxylenol. Okay. Now you look at the D choice, tincture iodine. So basically they are iodine solution. Okay, so it is an iodine solution where 2 to 3 percentage of iodine is present. 2 to 3 percentage of iodine in water alcohol mixture. In water alcohol mixture. So in tincture iodine, 2 to 3% of iodine is there in alcohol water mixture, that is called as tincture iodine. They are also antiseptic compounds. So here the question was chlorhexidine, that is present in Savilone. Now there can also be one question: what is chlorhexidine chemically? So just remember this thing: it is a biguanide derivative. It contains two guanate group. So it is a basically biguanate derivative. Okay, so it is an example for biguanate derivative, and this percentage is also very important: chlorosilinol and chlorhexidine. So you can remember that. Okay, so I hope the discussion is fine and you are clear with today's 10 MCQ discussion, which we have covered from the different subjects given in the analyst syllabus. Okay, so thanks for watching. Keep on watching. Thank you so much.